Today's guest is Dr. Sandra Scheinbaum, founder and CEO of the Functional Medicine Coaching Academy. Dr. Scheinbaum earned a PhD in clinical psychology at Fielding Graduate University, where she specialized in positive psychology, cognitive behavioral therapy, and mind-body medicine. Her innovative spirit led her to pioneer the use of neurofeedback in her role as director of a clinic for attention deficit disorders. In 2013, she earned recognition as the first psychologist to become an Institute for Functional Medicine certified practitioner. She's taught courses in the psychology of eating and the psychology of well-being and mind-body medicine in the master's program in human nutrition and functional medicine at the University of Western States. Founding the Functional Medicine Coaching Academy has brought Dr. Scheinbaum's career full circle. She's returned to her roots as an educator and is bringing innovative approaches to training students in the new and rapidly growing field of health coaching. A self-professed lifelong learner, her life's work has been centered around education, innovation since the very beginning. We'd love to have you screenshot your podcast player and tag us on Instagram at Health Coach Radio. And by the way, the show notes for this episode and all previous episodes of Health Coach Radio can always be found at primalhealthcoach.com/radio. In the meantime, let's get on with the show and welcome today's guest, Dr. Sandra Scheinbaum. Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
All right, welcome to the show, Dr. Sandra Scheinbaum. We are absolutely thrilled to be chatting with you, the leader at the helm of a health coaching school, a really cool one. I think there's so many things we can talk about. At coaches listening, like buckle up because there's going to be so much good real talk in this episode today. Want to throw it to you first, Dr. Sandy, and get a sense of your backstory. What brought you to the Functional Medicine Coaching Academy and sort of the 3 to 5 minute speaker bio so we can get acquainted with you?
Sure. Well, it's a long story, so I won't bore you with all the details because I'm old. And I actually started not in the place that I began. I began as a school teacher. I thought I would be teaching. That would be my career, and then I'd retire. And as it turned out, one career led to another, and then another, and another. Not everyone was successful. And I just loved learning, so I kept going on. So when I was teaching, it was in special education in a classroom. Then I was teaching at a college because I loved teaching, like training people to become special ed teachers. And from there, I thought, well, okay, I'm interested in this thing about how to stress management. And at the time, we're talking early 70s, people didn't talk about stress. They didn't mind-body medicine, like that didn't exist. But I was starting to incorporate that in work I was doing with kids, in teachers. I was training stressed out teachers to take a moment and breathe, which I got to tell you at the time was unheard of. Like I got thrown out of doctors' offices like there's no science behind this. Then I started training parents and leading all kinds of stress management and relaxation through breathing groups. And thought, okay, I'll go back and get my doctorate. I became a clinical psychologist then. And for many, many years, we're talking almost 40, I was a clinical psychologist. I had a practice and I specialized in biofeedback, which again, at the time was super new. And I then became known as that biofeedback lady, and doctors started referring to me. And so a lesson for the audience is like, choose a niche. I was known to be that person as opposed to this generic psychologist who serves everybody and anybody. And from there, I was so interested on a personal level in nutrition and movement. So I trained through the Institute for Functional Medicine and got certified. I was the only psychologist at the time in the first class that they had that was a certification class, and thought, okay, I have all of these bucket areas. I now know functional medicine, positive psychology, cognitive behavior, which is how you change your nutty, disturbing thoughts to ones that are just inconvenient and you can cope with. And then I put that together with mind-body medicine and said, hey, like, I can teach this. Mm-hmm. And fortunately, I had somebody who had been working with me at the time. And so she's a lot younger than me and she had very, very creative. So we just sat down and said, what can we do with this? I said, okay, well, what if we approach the Institute for Functional Medicine and see if they wanted to partner and collaborate with us? So that's what we did, and just took a chance. And again, it was risky. But there's a saying that the more open you are to a no, the more likely you're to get a yes. So, well, what could happen if we just, thought big? And that's what we did. So, and also not listening to the naysayers. So we were told, oh, you can't do this all remote. Like, you need to have part of this be live, where people will fly in and they'll be on site. Well, thank goodness I didn't listen. I said, nope, it's going to be all remote. We're going to do this. We can make it remote, experiential. There's this new thing called Zoom, which nobody heard of at the time. Like, we could put small groups of students together and have course facilitators, and it could be really interactive. No, that will never work. Well, it did work. And so I was 65 at the time when we launched. And again, my friends were retiring, and most people were saying, including my husband, like, what do you need this for? You could just continue as a psychologist and then retire. But I did not want to do that, because what I had was a mission. I wanted to see a time when there'd be a health coach in every medical practice, where it's a household word. And I knew that there was real magic in the power of coaching. So I came from the world of humanistic psychology, and that type of psychotherapy is totally client-centered, and it really is the roots of health coaching. It came from psychotherapy, then there was life coaching, and I was fortunate to have mentors this was in the 80s, who were just evolving this concept of life coaching. Like, what if we had people who were not having a diagnosed psychiatric condition that needed psychotherapy, and we could just help them reach their goals? And so then health coaching was a spin-off. So fast forward, now it's 5 years later, and actually, as we're recording this is our birthday. It's the day that we formally opened our class to a small group of beta students.
Get out of town. It's your birthday. I feel just privileged that we're here talking to you about this today. That's awesome.
Yeah.
And hey, something I want to applaud you for, that you launched this huge project at the age of 65.
Mm-hmm.
Oh my gosh. So again, in the role I play at our school is as admissions director, and I talk to people over the age of 60. I enrolled somebody who was 74 years old a couple weeks ago. And I get a lot of these people that are really curious now. They're retired, but they're one of very few people in their age bracket that they know personally that are as well as they are. And they really want to get out and help people in their age group. Talk about a niche, right? Really focusing on this baby boomer generation. So I just want to, first of all, thank you for following that mission, not letting your age be anything other than a number, and following through with that, because I just think it's tremendous. And I want to encourage other people to not worry so much about those little things and just follow the passion and the mission. I love it.
Absolutely. We have students in their 80s who are coming out of retirement. It's now, as you said, it is their mission. They're passionate about serving, giving back. And that's the key to longevity, when you have that mission.
I actually want to jump on that, because I know we're kind of flogging this dead horse about, like, yay, Dr. Sandra did it when she was 65, but this actually speaks to, just on a broader level, speaks to longevity, speaks to one of the benefits of taking control of one's health, is that you have decades of your life, more productive decades of your life than maybe what we all do. We all have the potential to be very productive well into our 70s, 80s, what have you. And I think that's kind of an interesting sort of script flip when you think about sort of, chronic illness and sort of the descent into aging, and how you kind of pack it in once you hit, your 60s or whatever. So anyway, it's just kind of a cool pep talk for health, I suppose, in general.
Totally. And I'm sure you find this as well. People come to coaching thinking that, okay, I'm going to train to be a coach. What they often don't realize is the process of getting that training and living those principles that you're learning, you're transformed. And so many of our students and graduates, This was transformative for me, for my family, my relationships improved, my ability to deal with challenges on a personal level. So whether it's because of your schooling, and then as a coach, when you're in that relationship with your client, you are healed as well.
Yeah.
Mm-hmm. Absolutely.
I really want to thank you for being such a leader in this space. I mean, I'm just filled with gratitude for the folks who pioneered it, because it's, you know, for Laura and I both, it's our second career. You know, we did a whole career before and now we're doing this. And I think we're both really grateful. And probably a lot of people listening, they're envisioning this as their second career. So because you're a pioneer leader in the space, this might sound strange, but I would love for you to give us sort of an off-the-cuff definition of what you believe a health coach is.
Ooh, great question.
Sure. So I want to credit my mentor, Frederick Hudson, who was one of the original idea person behind the idea of life coaching. He called it, and I was on a plane with him, I remember, he was my mentor, and we were talking about, he wanted to call it the Mid-Career Development Institute. And it's where you reassess where you're at. And what he says coaches does is, a coach inspires passion and purpose in others. And then Margaret Moore, who is widely credited as being one of the absolute leaders in the field, her program was, we're talking about being a true pioneer back in around 2000. And she says, coaches help people change when change is hard. And I love both those definitions.
Wow.
I love that. Coaches help people change when change is hard. It's so simple, right? Can be applied in any aspect of life and change you're looking to make. And here's the other thing that I love about it is there's nothing in there about putting somebody on a diet, writing out a meal plan, trying to diagnose or treat anything. It's not what it's about. You know, I get, and I'd love your thoughts on this, because we talked about it briefly before we recorded about working collaboratively, about how, the nutritionist and dietitian don't want us doing this, and the medical establishment doesn't want us doing that. And so we seem to be at odds sometimes rather than working collaboratively. But the actual art and that coaching relationship is what is a true differentiator between what we do and any other practitioner. And quite frankly, it's what finally helps clients and patients find success, because just giving them instructions does not work probably 80% of the time. So if we can improve outcomes by letting go of all that, my state says I'm not allowed to do this. Who cares? There is absolutely no law in any state here in Illinois or any country that I can think of for that matter that outlaws coaching. And the fact that this has to do with health doesn't necessarily by prescription mean, I've got to design a meal plan and put this person on a diet in order to make them successful. So I would love your thoughts around this scope of practice issue and how to help other coaches sort of let go of that a little bit and embrace their coachiness, I guess.
I'm so glad you brought this up. I am passionate about providing education and guidance in this area, because like you said, that's what we hear as well. It's perceived as a threat that there are nutritionists out there. So the nutritionists are threatened by the health coaches. They feel like they're invading their own turf. They say, I went to graduate school and I have all this training, and here's this health coach comes along, and what are they doing? Telling people about what they should be eating. And then as a coach, just as you said, my state, they're the nutrition law, the dietitians, they're against me. And so it's us versus them mentality. And what I say is the power of the coach, your secret sauce is a behavior change agent.
Thank you.
And when you are in that space, that's when the magic happens, because they don't need another expert. They have, I've got a lot of books behind me, and you have, how many diet books do people buy, and how many podcasts do they listen to about what to eat and how to work out, and they go to the doctor or the nutritionist or the dietitian, they get complicated plans, and they might start out like gangbusters, but then they fall off the wagon and they berate themselves, and they really need a coach. A coach is to be your personal cheerleader. And that's where the coach's magic is. You have the training to do it. So it is the very scope of practice of a coach that guarantees your success. And let me give you a few other reasons. You talked about collaboration. So I was a psychologist and I built up a really successful practice. And it's because I never tried to act like a psychiatrist or I did refer people to nutritionists, for example, even though I knew a lot about food. But what happens when you make a referral or you create a relationship with somebody in your community? Well, now they're going to refer to you. They're going to respect you because they know that you respect their territory. And so and it's also is a very important ethical principle that people's lives are at stake. And so if you have somebody who has very complicated digestive issues and you make a recommendation to eat something that most people would say is healthy, but for that individual, it's not. So if you respect the dietitian, the nutritionist, for example, and you refer for a consultation, and then you focus on how did your client, how do they feel about that? Are they going to follow through? What are the obstacles? But also you now have a relationship with that individual. You could give talks together. We did that all the time. We would collaborate with doctors in the area rather than trying to take business away and trying to be that person and basically practicing medicine without a license. And speaking to that, so the best referral is typically a physician referral. So people could find you organically through social media, and that's great. But often when a doctor says, hey, there's this health, I think you would benefit from some sessions with a health coach. Why don't you give her a call? Well, doctors, and we hear this all the time, they want somebody who's within their scope of practice. They do not want to refer to somebody who is going to be invading their turf, who is going to be stepping outside of bounds to interpret labs or recommend things directly, but somebody who works in a collaborative way with that doctor. That is a recipe for success. That was how I built my practice as a psychologist, to really respect that other profession and see us as we're all collaborating. So people are afraid that they're not going to get business if they stay within their scope, but it's the exact opposite. They're respected by other colleagues and their practice grows.
Yes. I think in the interest of maybe neutrality, I want to just put this out there that it's possible that there are nutritionists, clinical nutritionists, and dietitians listening, because I don't think we per se, it's possible they could be listening. So, but I think that what I'm hearing and what I believe is that health coaches are behavior change agents. That's what we are trained to do. But do you think dietitians and nutritionists could also be trained to do this? I mean, it feels like we're kind of separating these things a lot. But any dietitians or nutritionists listening could also take on this type of
absolutely. So many of our students and graduates have trained as nutritionists or dietitians. And then they have a choice. Either some people want to shift over and just coach, or they have dual roles. So they have some people that they see for nutrition consultations, then it may merge into coaching sessions. And so the role of nutrition is important. And somebody who has that training, they are the ones who are going to be the detectives. They're going to look at blood work. They're going to look at different ways to analyze what this person's exact nutritional needs are. And they can easily then shift to a coaching conversation to how that person can make it happen if they have that training, if they're so inclined. I have some people who I know who are dietitians, and they don't want that. They have a huge busy practice and they just want to be that detective. They want to have consultations, often on an ongoing basis, to monitor, to look at the data, to hand somebody recommendations. And then they are partnering with health coaches to collaborate, and they both grow their practices that way.
Yeah. I want to just give the backstory why I asked that question. Just a small anecdote is a few years ago, I was delivered a cease and desist letter from a dietitian who thought I was stepping on her toes. Some of her clients had come to me for implementation of behavior change. And I had a conversation with her directly because she was somebody that I actually knew in real life, and said, all I'm doing is helping people implement the information that you've given them. For some reason, they weren't able to implement it when they worked with you. If you're open to it, I'd love to teach you how to help people implement change. And she wasn't open to that. And it kind of became this sort of warring factions situation, She's got this graduate degree, this massive, internship she completed. I just went to a coaching school. And so it became an argument that I was uncomfortable with. And I am generally uncomfortable with it when I see it out in sort of the social sphere. So I just wanted to put that out there, like, in the interest of collaboration, these are skills that I bet you patients and clients wish their licensed healthcare practitioners had. But if you're a dietitian or a nurse practitioner or a doctor, or anybody listening, and you don't want to, great news. There's a whole bunch of us out there that really geek out on this behavior change stuff.
Yeah.
Absolutely. And if you're a coach and you're thinking, oh, I would like to collaborate with nutrition professionals, start with people who you have a sense share your values and are really have bought into a functional integrative medicine approach. Their societies for those nutrition professionals, as opposed to perhaps somebody who is in a hospital system and their role is to look at prescribing things like Ensure all day. So that perhaps wouldn't be a good match for you. But there are many people and a growing number of nutrition professionals who are interested in working in this way. So I wouldn't give up with the first contact, but they always provide education for what you're doing. So whether that's to your client, to the doctor, to a nutrition professional, let everybody know what a health coach does, because there's a lot of confusion. A lot of people think that a health coach is the one who's going to prescribe, and if clients like, okay, just give me the food plan. What should I eat? They're expecting that. They're not used to this kind of relationship. And so there's an art to providing that education about what the role is and what people really need.
And I also want to give health coaches confidence to know that, yes, talking about food is important as a health coach. It's just that step of putting somebody on a prescriptive diet that really you should not touch. And I'll just give you like two examples of just totally different clients. One, I had a woman in her late 60s who was insulin resistant. That was the diagnosis from her doctor. And she was given a diet that she was not feeling well on. She was given the traditional sort of diabetic diet that had way too many grains, fruits, and other things that were just too high in carbohydrate for her. But she was trying to stick to her diet. So me as her coach, I led with education and research articles talking about, some people in your position do better gearing back on this, and this is why, and looking to replace it with we talked about what a protein was. We talked about what fat was and where she might be able to find these sources. And hey, let's play with this. Let's do an experiment. Where would you like to start? What foods do you enjoy that you could look at this list of proteins and fats and think, wow, I really like these foods. I want to try eating more of that and less than this. And we were able to move forward to find something that she felt well on and was able to control her blood sugar. But I didn't give her a diet. Right? Same notion with another one. This is a gentleman that I worked with, big guy, and was really into training, really into strength training. He knew that was a passion of mine. And I asked him to fill out a food log so we could talk about how he felt about it. And the thing that stuck out to me is this guy's not eating nearly enough protein for his size. He's a 240-pound guy eating like 50, 60 grams of protein a day. Training 6 days a week. Okay. So instead of me saying you need to eat X amount of protein, it's let's talk about what your body needs to fuel the kind of activity you're telling me that you enjoy and the lifestyle you want to live. And, let's talk about, and we did a little game. We played a little game on let's find the protein in this daily like menu that I gave you? And what do you notice about this? And where might be able to change? So it was me kind of challenging him and asking him to brainstorm about where he could do better and what his sort of next step's going to be in the next coming week on how to improve what he's looking for. So that's a little bit of a difference. I didn't just hand this guy a bunch of macros. It was, let's talk about this. It was a form of education, resources, guidance, but most importantly, collaboratively. What do you think you can do? What do you enjoy to be able to move the needle forward? Rather than just saying, oh, nope, these macros are all wrong, or this is all wrong, and this is how you need to fix it.
I love that. And your example is spot on. Because coaches do have a crucial role in providing education. And it is not outside the scope of practice to let the world know about food as medicine. And we have graduates who have written books, cookbooks, they have blogs, they have podcasts, so many ways that they can get out there and help, and then to provide this information, education, crucially needed. You can also, within the session, as you described, provide education, because people will ask, and you can have that great conversation. You can also go to resources. So if there are experts, you can pull, there's a book. Are you interested in looking at this? Here's some guides that have been written by so-and-so. And so you pull out research or a book or a guide or PDFs or something, so that you are not saying directly, this is what I recommend for you, but here's the research, here's information, for example, for vitamin D, rather than saying you should take so many IUs of vitamin D. Well, that would be out of your scope. But here's a recent article by this well-respected physician or researcher, whatever it might be, that's showing the importance of vitamin D for coronavirus, for example. And so you are passing it along. You're always asking permission. Are they interested? And it is always that client who's in control, but you can certainly provide a lot of information during those sessions and to the general public as well.
Absolutely. Thank you for sharing that. And actually, it's so wild because I just had that exact conversation with a group of clients I was working with in a large group program who wanted to know my opinions. And you get asked this a lot when you're a practicing coach, like, well, what about hemp hearts? What about almond butter? What about, it's like, And I got asked about vitamin D supplementation. And I simply said, well, if you're open to it, I follow a really amazing vitamin D researcher. She's the go-to resource. Here's her podcast. Here's her blog, give it a read. And I think the clients thought my role was to just answer these questions. Absolutely. But I just never will. And it goes, even the hemp heart question came up. Can I have hemp hearts? I'm like, what's the context here? Like, let's talk about your relationship with hemp hearts. I don't have any horse in the hemp heart race, but what are you making some kind of hemp heart smoothie that I think is probably not the best breakfast choice for you, or like, what is it? So I think that I love that you brought up that we can educate. We can educate, and we can provide resources, and our clients are expecting that of us. Sometimes I've seen coaches go completely on the other way, where they refuse to answer a question.
Right.
They get so mired in this sort of motivational interviewing techniques that they're like, well, what do you think about hemp hearts? And it's like, sometimes the client just really wants an answer, so we can't shy away from education.
Exactly. Oh, as you were saying that, it reminded me. So we have coaching and action training videos, and we'll show the bad coach, and it's super exaggerated. And so we have a little scene where this person is getting increasingly frustrated because the coach isn't saying anything like, well, what do you think about that? What are your feelings? And it's kind of like the old psychotherapy, where it's like, oh, you're just like, what are your thoughts on that? And the kind of voice to say it, and just tell me the facts. And and that it goes along with when you're client-centered. What do they want? And so having that connection, when you're doing active listening, then you have a sense that this person is confused. What do they need at that moment? They need information, they need a resource, they need whatever reassurance. Like that's a question I get asked a lot. Here's a resource that some people, have said, that have told me have found it helpful, and would you like to look at it? And it's always like sensing, this is what this person in front of me wants, and how do you make that happen to be client-centered?
I know what always strikes me when I talk to, again, leaders in the health coaching space is that what we do is truly a relationship. Like, it's not a contract, it's not an agreement, it's not a program, it's a relationship, right? And in any relationship, what's really important? Communication, right? Communication, your language is so important. So, I mean, I've said it to clients like, I have an idea of what the answer to this question might be, but I'd love for you to just explore some of your thoughts on it. Let's work this up together. And it is truly collaborative, and that takes just a lot of practice. I adore the fact that you have these exaggerated sort of terrible coach videos.
We need those.
I know, that was so great. Talk a little bit about, because you touched on active listening. What do you think are some of the other conversational necessities that coaches really should be practicing? And I'm using the word practice intentionally because it takes so much practice to get good at it. It's an exciting time to be a health coach. Scientists are uncovering the mysteries of the human microbiome. We're now gaining clarity into complex gut health issues we didn't even know about a decade ago. This means it's also a great time to become a gut health expert. Primal Health Coach Institute's Human Intestinal Microbiome in Health and Disease Specialist certification is for health coaches who want to help people heal the root problems of many of their health symptoms and conditions. A recent survey spanning 73,000 people across 33 countries found that nearly 40% of adults suffer from a gastrointestinal disorder. As an expert in gut health, you can offer unique programs and services to clients looking to manage or reverse a diagnosis such as an autoimmune disease, irritable bowel syndrome, or type 2 diabetes, or those who wish to improve their overall health. Gut health expert, cardiologist, and best-selling author Dr. William Davis teaches you everything you need to know about the human microbiome, including coaching tips to give you the confidence and credibility to support your clients and help them heal their guts, sleep better, gain more energy, and enjoy stronger immunity, balanced mood, smoother skin, and more. Find out more about how to become a gut health expert. Visit primalhealthcoach.com.
So one of the key researchers in leadership development and organizational psychology is Richard Boyatzis, and he talks, and he has a great book, Resonant Leadership, talks about mindfulness, hope, compassion. So mindfulness, that is active listening, and you're in a flow state. So if I was in session with you or my client, like, I wouldn't have any awareness of what's going on around me. You are totally keyed in, focused on everything that that person is saying. It's a little more challenging with if it's telehealth now, but you can even read body language through that platform. And hope. So one of the most important factors is hope. And often people come away from a doctor's visit having lost hope. Mm-hmm. Being told, oh, you're just going to suffer from this the rest of your life. Here's the drugs. This is a condition. You've got rheumatoid arthritis, and now it's part of you. And okay, then so long. Take your meds. A coach, whatever it might be, offers hope. And when somebody has that, then the body can start a healing response. And so it's really, that's what's so special, that you feel heard because somebody's actively listening. You feel understood. You also have a sounding board. This person is not going to say, well, that's just the way it is. Mm-hmm. And they may have lost hope, or they may have heard from family and friends and the professionals that they've seen that there is no hope. And so a coach brings that, and compassion, which goes along with it. Mm-hmm. So really stepping into, we call it empathy, or stepping into that other person's shoes and really being there. and having that sense that you are understood, there's this connection. And many people think, I don't have what it takes to be a health coach. I don't have a background. I wasn't a nurse or a nutritionist. And how could I be a good coach? I wasn't in healthcare. And actually, the data shows, no, often the higher you are as an expert, the more degrees you have in healthcare, the more you struggle. So we have some teachers who've gone through who have been in like high positions of leadership in Institute for Functional Medicine. They are like doctors and high level practitioners. And they struggled to, when we had training sessions, to have the coach approach because they kept falling into the expert role. Mm-hmm. And they had to, no, you're an expert again. Can you rework that? And people who come because they have a calling to serve others and they feel like, yeah, that's me. I'm a good listener and I can connect with people. And that's what you need in coaching. So often people overcomplicate it. They think, oh, I need to have a checklist for my first session and I need to rehearse what I'm going to say and have my list of questions listed out. And those sessions aren't as effective or effective at all. So when you go where the client goes, it's like a dance. Sometimes you're leading, providing education, but a lot of the times it's just you're taking the cues from that individual. What do they need? You may come in thinking the doctor, if it's a referral from a doctor, and they may have said, oh, I want this person to, follow this food plan. And that person comes into a session with you and they want to talk about the relationship with their spouse or the stress they have at work. And you go there. So that's the real beauty of this relationship.
It's huge.
One of the coaching techniques that we teach, and I'm certain that you probably do too, is like one of the first questions you can ask in a coaching session that's extremely impactful is, what is your intention for this session? What would you like to get out of this session? And I'm thinking to my session yesterday with a client where in her check-in form, it seemed like we were going to talk about one certain thing, but as it turned out, she wanted to figure out how to factor tacos back into her life. So that was the whole coaching session was about tacos. I was distracted by her.
Yeah, exactly. And that, kind of the basics of like humanistic psychotherapy. It's like, how do you want to spend your time? What would you like today? And then you can also dig into those broader questions like, what do you want your health for? What matters most to you? Looking at what their dreams are and visions for the future, and then how they can design that and how they can start now and where they want to start in those. Also like tiny steps. We work with BJ Fogg, who wrote Tiny Habits, and it's that, tiny. So, you're going to start by just taking your sneakers out of and, putting them out so that you can see them. So you have that prompt, and then you celebrate after, no matter how small, as you're progressing towards a bigger goal. So that's such an important strategy.
I kind of liken coaching to the difference between, just giving a man to fish to feed him for a day versus teaching a man to fish to feed him for a lifetime. And the role of the coach here, the way I see it is they still need a fishing pole and they still need to know where to go find the fish. Okay. And, that's just that. Yeah, exactly. I use this because my husband loves to fish, right? And there are days where he's just not successful because he doesn't know where to go or he's got the wrong equipment, right? So that's kind of how I liken my role as a coach, is to just help my client feel equipped and confident that they have the tools they need to be successful in the direction that they're going. And that's the way I view all the nutritional knowledge that I have, all my fitness knowledge it's not to give them an answer. It's to equip them with the tools and the confidence to know they have the answer or where to find it. And I use these tools with my children all the time when it has to do with learning to read or math. I could just give them the answer because it's easier for me to but they're not going to remember it. And they're just going to keep coming back to me asking the same question because they know I'm just going to give them the answer. Whereas with clients, it's about empowering them. And this is a tough one and maybe this would be a great, I'd love your comments on this. Really, as a coach, you've been successful when your clients don't need you anymore and they leave you. How am I going to fill my pipeline? How's my business going to continue? You know how? By being that great coach. Trust me when I tell you this will come back in spades. But it's a bit of a mind shift for people that come to this space as fitness professionals that are trying to keep a client long-term, as well as practitioners like chiropractors and things like that. Do you have any thoughts around that?
Absolutely. So I saw this for years and years when I was a psychologist. People didn't need me. And so what would happen? Well, number one, it's a revolving door because of that relationship. So they're done with that issue now, but then it might be 5 years down the road and you'll hear from them. Or now they're saying, hey, my daughter really can use can you work with my daughter? Word of mouth is the best referral. It's proof, it's a testimonial. And so they're going to go out and they're satisfied customers and they're going to tell their friends and they're going to have a family member come to you. And so, and then that person will be satisfied and they're going to tell some people. So that's how you grow. And so it's repellent when, as a coach, you appear needy and are saying, well, you need 10 more sessions. People sense this. They sense that you're doing it because, you know, you just want to get paid or it's a big part of it. And when you let them go and when you encourage and you celebrate and you acknowledge how far they've come, and as a coach, you can ask for a testimonial or encourage, or you can have that to help you grow your business as well. So it's another way, but yeah, and they'll come back. Let's say you saw them for one-on-one and now you're starting a group, so they can come, they might be fascinated by that new topic that you're focusing on. They may come to a lecture you're giving, but again, they're going to refer their friends, their colleagues, their neighbors.
Mm-hmm.
Exactly.
Oh, well, if I may just translate what you just said, is the way to grow your business is to be a masterful coach.
Absolutely.
It's a slight passion project of mine because, you know, again, we talk about these filter bubbles, and I think we should talk about this too, because we were talking about this before we pressed record about the saturated market. But before we get into that, you know, it's because as health coaches and health, honestly, geeks, what we see in our sort of social media filter bubbles is a lot of health and wellness professionals. So we get the sense that the market is saturated. But what I also see, and I'm sure a lot of people listening, is a lot of, with absolute complete respect, a lot of business coaches encouraging us to sell membership programs and do these big click funnels and upsells and you know, scale your business without, or maybe just skipping over the coaching mastery, the getting really good at coaching and changing people's lives piece. So thank you for putting that out there, because I think that we're probably in alignment with you on that one.
Oh, absolutely. I totally agree. And far from being saturated, we have only just begun. Now, I started the school, it was 5 years ago, and name recognition wasn't so good, and people were worried about jobs. And what have we seen? We've seen an explosion of growth. We're just on the cusp. And when I look at the movement in general, so we're still not at the point where there's a critical mass to have this as a coaching profession. That's what we're working towards. We need more people badly to become coaches so that this can become a household name. So you're totally right. You, in our social circle or in our Facebook groups and people, yeah, everybody knows what a coach is, but you go out on the street and you ask 100 people and probably, 90 of them would have no idea or they'd get it wrong. And so we do need to grow. We do need to have more people there. And the idea that it's a rising tide lifts all boats. And so we see other people coming in, or I feel that way about coaching schools. So, there's more and more. When we started, or, we were the first to, integrate positive psychology and functional medicine and that state. And then, there's other schools that develop that are, have the same philosophy. I celebrate that, because we need more. It means that these theories are good. And so we want to have more choices and have it so that it's recognized as, and then what's happening as well is that this is no longer fringe. So when we have the AMA working with the National Board for Health and Wellness Coaching on CPT, now those are the codes that you need to bill insurance. This is going to happen. It's just down the road, and it needs people using those codes and doctors accepting, and more hospital systems, companies who have places like Amazon for their workers. They have a series of centers that they're opening. Well, health coaches are part of that. So the other thing that is so, so exciting, why we're not saturated, is because we've only just begun in terms of connecting the human element of coaching with the explosion in artificial intelligence through wearables, through things like continuous glucose monitors and your watch, your Oura ring. And this is becoming more and more advanced. More and more people are using this. And so we talked a little bit before about clients, I should say, who are who are monitoring their own health data. There's a tremendous need for coaches to be in charge of that, to say, oh, hey, Mrs. Smith hasn't slept for 5 nights. I'll talk to the doctor about that, and being that communicator, helping people to understand as they're taking more of charge of their health through the wearables that are becoming more and more sophisticated, the explosion of this. And there's even talk like within Medicare, and for this to be paid, where practices are going to be obligated to have coaches. So we're again just the beginning of the influence of health coaches. And I might add one more thing: it's affordable. So we talk a lot about social determinants of health, people who don't have access to like functional medicine, integrative medicine doctors, and the coach can play that role because it's an affordable model, and groups. That's the other thing. We're going to see this in the future. So much demand for groups in remote ways.
Oh, we started seeing it a couple of years ago when my life insurance company came out with a health coaching program that I could adopt into. And the health food store down the street from me was hiring an army of health coaches. So, and the VA is hiring health coaches now. You've got practices like Virta Health that are 100% focused on solving the type 2 diabetes problem. Guess what? A health coach is an integral part of that clinical team. So we've been seeing it for a couple of years, and I agree it's going to continue to grow. And if you just think about the sheer number of doctors we have that take on, what does the average doctor have? 500 patients, 700 patients? A health coach cannot take on that many clients at once. So just think about the extrapolation of how many health coaches you need to serve just the sheer number of people that need medical care. We need far more health coaches than we need doctors to serve this community properly. And then, oh, by the way, bringing those health coaches on will then help alleviate the burden on the medical staff and community. You'll see far fewer doctors just frustrated that their patients aren't getting anywhere, and they feel like they're just on a treadmill of patients coming to them that just need more medication or aren't getting better because there's just no mechanism for when they leave the doctor's office. I just think it would alleviate so many of the problems of just the medical system in general. And I agree with you that we have just seen the tip of the iceberg of how this is going to continue to grow. And I think there's plenty of room because I heard you mention earlier about specializing. I think this is also a reason why health coaches need to specialize, because patients are coming to doctors or other professionals that have unique situations and conditions, and they need to work with a health coach that can relate to that particular condition, circumstance, whatever the case may be. And I think if you've got coaches that know what it's like to live with an autoimmune condition and want to help support somebody, or coaches that know what it's like to live with endometriosis or a child with autism or whatever the case may be, these specialties are so important because they're unique, and the needs of either the patient or the caregiver are unique in every circumstance. There's so much room for coaches to be successful and for patients to get that really unique, specialized care that's just so personalized. I love it. So you were saying you were specializing in biofeedback in particular, and that's what helped your business grow. Would you elaborate on that a little bit for us, and to try to encourage coaches to not be afraid to do that?
Yeah, so this was way back, late 70s, early 80s, and biofeedback that means you're getting feedback about your body. And so, these are biofeedback devices, your Oura ring, your watch. But back then it was breathing belts to help people breathe better if they're in panic or any kind of chronic pain. And it was a specialty. And there were so few of us. And literally, I was in Illinois, there was like 30 in the state of that. So what would happen is I would have somebody come to me, and I always wrote a thank you. At that time, it was a handwritten thank you note to the doctor, or if they had referred, or if somebody came to me and a doctor didn't refer them, I would find out and I had them sign a release. And then I would write, your patient so-and-so has been seeing me for 8 sessions of biofeedback. I would give a little definition of what it is. And even please, if you'd like to talk about this, and I use the doctor language. If you're talking to a doctor, you always want to use their language. And interested in talking about this case, although I wouldn't call anybody a case, but for a doctor who they were talking about it that way. So what would happen is that I would send a follow-up, describing the progress that person made. And then they would say, oh, are you open to having, a referral? I think I have a few other people who might benefit. And so it grew that way. And they knew me as a biofeedback person, because when they had a person, let's say they had migraine headaches or they had panic attacks, and I don't know if it'll help you, but I have some other patients who've done well, so go see this biofeedback lady. Don't quite know what it is she does, but okay, I'll refer you to that. And what would happen is that's how I grew, and I got people from a wider geographical area where they would come, like they would drive 2 hours to see me. So I got a lot of the pediatric neurologists on board, because this was a great way to help kids who had severe headaches. So they were sending me people from far distance. They were driving across the state line to see me. That never would have happened if I was a generic psychologist and I would see my colleagues who were that. And they would place these ads in that time. You had ads in the newspaper, and they would list 12 conditions. Or even worse, because they would say, I can do cognitive behavior therapy and I can do psychoanalytic. And that's not speaking to the person who's reading that. But if they would say, are you suffering from headaches? One thing, then you become known, and then that resonates. And some people fear that, because they think, well, what about all the other people that I can serve? What I do can help everybody. And other people will come to you. So even though I specialized in headaches, for example, panic attacks, didn't mean that other people didn't come to me with other things. But it's so, so important. And how do you find that? Well, typically you do look inward. It is your story. So I specialized in panic because I had panic attacks for many, many years. So I connected with people, and I could share my story and offered hope. Well, if I could overcome panic attacks so bad that I had to go to the emergency room, then maybe I could do it too. I can follow, what some of the strategies. So it's super, super important to get clear, and what you start with might not be what you end with. So it doesn't mean it's set in stone. And if I decide I'm going to work with women over 40 with certain hormone imbalances, doesn't mean that I may shift at another time in my career.
There's so much wisdom there, so much wisdom for the basics of marketing and how do I find clients, which is the number one question we get asked when our students graduate. All right, where's those clients? Where do I get them? And one of the first things we have them do while they're in school is write their story. And a lot of times we get a little bit of pushback. We're like, oh man, do I have to? And it's like, you do. It really helps, the clarity that you described, because people don't know that they need health coaching, or they don't know that they need functional nutrition. Nobody knows what this stuff is.
No.
Nutritional therapy. What? I don't know if I need that. Even gut health. I don't know if I need that either. What am I struggling with? What's keeping me awake at night? And to your point, go with one thing, because that's a very crystal clear message that's going to resonate for some people very directly. And you can change it later, and other people will come to you as well. It doesn't narrow your opportunities when you narrow and clarify your message. So thank you for saying that. We've been teaching that for a little while. It's hard though, because it goes back to that scarcity sort of approach, that scarcity mindset. There's not enough clients, but there are.
Yeah. And you made such a good point. You speak to them. I hear this all the time. Well, I help people find optimal wellness. Well, people don't talk about, I want to find optimal wellness. They're tired and, oh, I'd like to have more energy. I'd like to sleep better. And so you listen to people, you do some research and listen to how your clients are describing what their challenges are, or your friends, or how do normal people talk? And you use that language and you speak so you feel like you're being understood in whatever you're doing to market, as opposed to using anything like jargon type talk. Don't assume people understand what you're talking about.
And to close the loop on that, that's where your story comes in handy, because then you're not mind reading. Like, I don't know what an endometriosis sufferer is struggling with, because I've never had endometriosis, but I've had insulin resistance. I know what that feels like. So I'm just going to speak to that, because I remember how horrible that felt, for example. So connecting back to your story, to how you felt, really, we don't need, you don't need to write the big, long, detailed, dramatic, epic tale, but how did you feel when you were going through your health transformation? That's what you need to hook into with people.
Yeah. We hear from people too, almost a little too shy to tell their story. They're afraid to put themselves out there, and it's okay. That I get. And so that's fine. Don't necessarily talk about yourself, but talk about the person you serve and why you feel you can help them because you had this experience, right? So you can elevate the person you want to serve and use your own story as a way to connect to that person. But really what you're promoting is them and sort of where you're focused.
Actually, from a marketing perspective, you wouldn't want to be talking about yourself.
Right.
Like, hi, I'm Erin and I went through insulin resistance and this is what it felt like for me. No, just
who cares?
Have your story, connect to how it felt, and then put this is what I help people feel better in this way story out there. Like, you're speaking to your ideal client. Writing letters to them is kind of how I always think of it. But you have to start with your own story so you can connect to what it felt like.
And I have a question, your thoughts on something, because this comes up for me a lot on the phones in admissions is, so will this make me a holistic health coach? I want to be a functional health coach. What about an integrative? And I'm just sitting there like, oh my gosh, your clients don't know what any of that crap means. Stop it. It doesn't matter. You're a health coach. Talk to people about what you specifically do. Could you on that, please?
Yes, I'm so glad you brought that up, because we have these buckets and we have people trying to differentiate and writing articles about, what does this mean? It's holistic versus, it reminds me of my days in psychology, where we debate, this, I have a psychoanalytic orientation and I have a cognitive behavioral, and I was always about integrating. It doesn't matter what you call yourself. They're just labels. And like you said, people don't really know the difference. They know they're hurting. They know they're in pain. They're suffering. They feel lonely. And you want to have that connection. And so, yes, we're a health coach. And then, we have, and speak to them when you define what you do. That elevator speech is often so confusing when people will ramble on and on about the modalities that they use, as opposed to, I help people who are suffering from migraine headaches because, I believe that nobody should be in pain, or, just speaking to them as opposed to just debating your label. They are just words. And the truth is that there's a lot of overlap, and so, it really, that's not the important part.
Thank you.
I can't believe people ask you those
they
questions.
They do. Yeah.
Dr. Sandra, do you have any thoughts on board certification? I know the FMCA is a accredited school with the NBHWC. What are your thoughts generally on board certified health coaching?
Sure. So the National Board for Health and Wellness Coaching was many years in the making. And the first and foremost, it sets a standard so that, there are certain criteria. We talked a lot about scope of practice. And so they're industry leaders and highly respected. And they're doing such significant work to advance the field because they are aligned with the National Board of Medical Examiners, now with the AMA. They're the primary driving force for getting insurance reimbursement. Right now it's at Category 3 CPT, which means it's trending. So coaching has been identified as a trending, promising service modality. And then if enough people use the code, it'll be bumped up to a Category 1, which means that the payers will then be reimbursing. And so in that arena, it is really helpful, to support their mission. Mm-hmm. And will it make a difference if you are thinking about becoming a health coach? It depends. If you want to be 100% as building your own business, we talked a lot about the public and what they understand and what they don't. Nobody's going to come to you unless they do a lot of research in advance to say, hey, are you board certified? And are you board certified by the national board? So most of the time, they're not going to ask that. They're not even going to know what health coach is if they've been referred, for example. So that you can have a very successful business. You may choose, well, I'm going to be somebody who is a writer, a blogger, a YouTube, trainer. It's not crucial to have that board certification. If you are somebody whose goal is to work in a medical practice, in a hospital system, to get hired by one of the big payers, by one of the large corporations, then you might see increasingly in a job description that a criteria for that applicant would be to have that board certification credential. So it really, again, it depends on what your career goals are and where you're at, in terms of needing to have that credential.
Great summary. Thank you.
Yeah, thank you. I know we've been trying to continue to support that mission because we believe in it too. Our course is approved there now. We tacked on a whole separate course to sort of get us there because we believe in that mission. Because, look, let's be fair. There are folks out there who are out there, and I applaud them, trying to do some good, right? So the thing that comes to mind is Beachbody coaches that are calling themselves health coaches, and they're encouraging people to get out there and move. And they use the same title I have, but they've got no education at all whatsoever and no real training other than posting pictures on Instagram of workouts and selling a lot of Shakeology. We actually get a lot of Beachbody coaches that come here because they've begun to realize, holy cow, people are actually asking me questions and I actually feel obligated to know what I'm talking about now. And they'll go to seek a certification of some kind. But then there's different levels of coaching training out there as far as the depth of the education, the relevance of the education, some coaching programs calling themselves health coaching programs that don't actually teach coaching.
Correct.
Okay. So this is where this sort of third party credential, to use to your point, kind of set this minimum standard. Mm-hmm. So I 100% agree with you. If you want to work in the clinical space, I think you're going to really want to go that direction. You're going to need to go that direction. But for those that are just going to work independently in their own private practice, how are you going to use that credential in your own private practice to make it financially viable, to go through the steps and to pay for it and to have to hold on to it and all that other stuff? For some, it will make a difference just in their own mind. Mm-hmm. That I hold this and it builds confidence for me and all that. But I'm thrilled that this organization even felt it needed to be there, that's how much this is growing and how viable that this profession is, and that there is an organization out there like the rest of us little people just out here trying to elevate the status of health coaching in general. It's fantastic.
Absolutely. And I think it is the gold standard. And so when you pass the certification exam and you now are National Board Certified Health and Wellness Coach, there is that pride. And it really is something that when you are presenting yourself to get referrals, or when clients come and you are board certified, and be really clear that you are certified through the National Board for Health and Wellness Coaching, because there can be some organizations that are popping up that look deceptively like the national board. So that is, there is only one national board for health and wellness coaching. And again, I think that insurance reimbursement, if we're going to grow this field, when being able to have a third-party payer will increase access to coaching, as well as really elevate it to be a very well-established profession, not just a fringe, holistic alternative.
It's so exciting. What an exciting time.
I know.
Oh,
I love it.
so I think it just, where do we go from here? I'd love for you, Dr. Sandra, to tell us about the Functional Medicine Coaching Academy, how you teach coaches, what the program's like, just in case anybody's out there contemplating making the leap into a health coaching school.
Thank you. So we're a collaboration with the Institute for Functional Medicine. They train the practitioners. And as part of our collaboration, they are intimately involved with the curriculum design regarding functional medicine and functional nutrition. So what does that mean? It means that their faculty teaches those components, that they have particular food plans. And again, as we talked about earlier, we teach them how to do this within scope, to educate, to refer to the experts, but not to diagnose or prescribe those plans. But then what I did when I developed the program is I looked at, well, if we took these fundamental functional medicine principles where we're looking at what are the root causes of illness, looking at a systems approach that's evidence-based, that's client-centered, and put it together with so many of the things that I had trained in and knew were very, very important to help my clients when I was a psychologist, and that is positive psychology. And that's studying how do you flourish? What are the strengths? What constitutes a life well lived? And how somebody can use their character strengths, for example, to make these difficult lifestyle and dietary changes. And so integrated that with the functional medicine principles and then mind-body medicine strategies, because as a coach, you have a big role to play in helping people to become more resilient. We talk about anti-fragility, and then put that together, and also the psychology of eating principles. So it's taking all that information, and then how we present it is it's online, but it's experiential. And so we have training videos, but the most important part is a cohort group model. So we've been using Zoom since the get-go, and I have cohorts where they meet in groups of 10, 12 people. And over the course of a year, you really get to know your group. It's like you're going to camp, and this is your cabin, and there's tiers of people that want to, there's course facilitators. And so you practice. I'm a coach, you're the client, and go around, and there's an assessment of your skills and giving them the confidence. And then we also have alumni program, we have Ask the Experts, and we have a business building, which we're calling building a heart-centered business outside the box. And so teaching some really basic principles that start with mindset and how do you establish your niche, and bring in people who are teaching that for us, so that it's a parallel track that they can go through at the same time.
Oh, I love it. I love it that you're teaching that side, because when Erin and I went down this path and went to our first schools, they didn't teach any of that stuff. We both had to start like, great, I'm certified now.
Mm-hmm.
Yeah.
Where are all my clients? And so I just love that organizations are now recognizing that we can graduate the most productive, talented, well-educated, and trained coaches, yet 80% of them are unsuccessful because none of them know how to start a business. Yeah. So I love that. And we're seeing that change. Our school teaches it. Your school teaches it. I think we're going to see more and more. So I love that. Fantastic.
I love teaching that. In fact, I have office hours, both for students and people who stay on for our alumni program. And yeah, we walk them through some of the challenges that they're having with starting a business.
I love it.
Nice. Great. This has been awesome. Just a really great health coaching pep talk. I'm feeling inspired, feeling renewed, exciting times.
Me too.
We're delighted that we got to spend time with you.
Yeah.
You guys are fantastic. It is so great to have a conversation and feel like we're so connected, that our missions are aligned. So it's been great.
I love it. Where can our listeners find you if they want to follow you, check out the school? Where should they go?
Sure. Functionalmedicinecoaching.org, on Facebook, Functional Medicine Coaching Academy. It's Functional Med Coach on Instagram, and I'm Dr. Sandy, Sandi, if you want to follow me personally.
Dr. Sandy, love it. Awesome. Thank you so much for your time and for your generosity, Doctor.
Thank you. It's an honor to be here.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.